365, the natural way, every day. Health 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 365, the natural way, every day.
Hello and welcome to Health 365. I'm your host, Dr. Ruby Lathon, and on Health 365, each show, we try to really uncover health myths and really teach you how to take charge of your own health personally and not necessarily rely on traditional medicine. So today we're going to talk with a really special guest, Dr. Baxter Montgomery, who takes a very unique approach to treating his patients. Dr. Montgomery, welcome to the show.
Thanks for having me, Ruby.
Great. So you are medical director of Montgomery Heart and Wellness in Houston.
Yes, that's correct.
Right. And how long have you been in practice?
I've been in practice for a little over 14 years, and my practice is a general cardiology practice with a subspecialty in dealing with heart rhythm disorders. And so I practice in the Texas Medical Center, and my practice is in many ways a traditional practice of managing patients with chronic illnesses related to heart disease and other conditions that are related to that.
Okay. So you have a variety of patients a lot of patients who have heart failure, heart disease, or at varying stages of that.
That's correct. That's correct. My practice, a major component, or I should say one component of my practice is like the typical medical doctors or cardiologist practice. Individuals are referred to me with heart disease, or they may be self-referred with heart problems, and I help them manage those problems.
Okay.
And for the last 5 to 6 years, we've taken a slight different approach to managing those same patients.
Great. And I know that's a lot of what we want to talk about today is you've been in practice for a number of years, and now you've kind of taken a more, I guess, a holistic approach to things. Kind of what's different now about your practice than when you started?
Well, the different approach now is that we've taken a nutritional approach, a nutritional intervention, if you will. We made that the foundation of how we manage patients' illnesses. Over the years of seeing patients with many heart conditions, congestive heart failure, coronary artery disease, heart attack, and managing those patients over time, despite all of the technology, advances in medical technology, I noticed that my patients over time have gotten sicker despite my many efforts. And after doing quite a bit of research, I noticed that there are many individuals, both in the lay public who are publishing work, and also individuals who are also practicing in healthcare, utilizing nutrition as a way of helping patients.
Okay. So when we talk about using nutrition, you're talking about actually using food as a method of treatment for heart disease.
That's correct.
Okay.
One thing I discovered a while back after applying nutritional methods, I discovered that plant-based nutrition was optimal for human health and human maximal human function. The other thing I discovered was that when I take patients off of the standard American diet and put them on a pure, natural, plant-based diet, amazing things happen. I saw individuals with advanced disease, heart disease, coronary artery disease, heart failure. These conditions start to reverse in very short order.
Really? That's a radical approach from what a lot of people are doing right now. How has that been received by, let's say, your colleagues and things?
I think I've gotten somewhat mixed reviews. There's been some lukewarm reviews, but surprisingly, a lot of colleagues who've really supported me on this. I have a number of colleagues, some interventional cardiologists who refer patients to me, patients whom they have done all they can do for them, and they don't have any other solutions. They've referred patients to our program. They've gone through our nutritional boot camp and other programs. They've gotten some good results. And a number of other doctors, for instance, who's actually gone through our program themselves. So
Really?
we've gotten some
Okay.
Reasonable amount of support. More to my surprise, we have.
That's
Yeah.
great. That's great. So you mentioned you've kind of taken people from the standard American diet to a plant-based diet. And what would you describe as the standard American diet?
Well, we're all familiar with a typical breakfast, for instance, eggs, bacon, perhaps sausage, toast. A lunch may consist of a turkey sandwich. We have grilled foods, or there are also processed foods. There are many foods that are instant foods, that are microwavable foods, that are loaded with preservatives. And so the typical American diet is often something that is fast, loaded with maybe cheese or other forms of dairy products, some form of animal protein, such as chicken or fish, and we consume these foods on a regular basis.
Okay.
When I remove these foods from our patient's diet completely, then we notice that the body tends to reverse these conditions, almost as though if you had somebody's thumb on the vice grip and the pain that's there while the vice grip is there, then when you remove the vice grip, the pain goes away almost instantly. We see this type of reversal with changing their diets.
Now, have you seen that type of reversal with your traditional approaches?
Well, not as drastic. Now, granted, if someone's acutely ill, for instance, I have patients who are in the throes of a heart attack. Those individuals need to have the traditional state-of-the-art medicine. We will rush them to the hospital.
Right.
They'll get their stent, their angioplasty, and to halt the condition. Individuals with, say, an acute worsening of their heart failure, these individuals need to have their medication. So I've integrated this nutritional approach with the traditional medicine. However, the different approach that I take is once they're stabilized on the acute side, then the nutritional part is integrated right then and there. I don't stop by just stabilizing their condition. So
Right.
I may implant a pacemaker in someone or defibrillate in one of my patients who need it because the heart is weak or the heart is not beating fast enough. But once I've done that, at the very same time almost, they're on a natural plant-based diet because their whole body needs to be treated in this manner.
Okay, and that would be what's different, I think, about a lot of people who have a surgery. I know they tend to go back to the diet that maybe got them there in the first place.
That's correct. That's correct. In fact, I was talking to one of my colleagues just the other day. I was at a conference, and another cardiologist, and we were talking about how, in the old days, and not even so much in the old days, but not too long ago, the surgeons would tell the patient, well, after they had the bypass surgery, well, you don't have to take your medications, you don't have to exercise, you don't have to go on a special diet, you're fixed. And,
Really?
and that was the
Okay.
thinking, and
Back
certainly when I was
then,
in
right.
medical school, and some of that thinking has made its way forward. And we know that these patients are not fixed because the underlying disease process is not so much some kind of genetic disorder per se, but the underlying disease process is the abnormal behavior. The abnormal behavior is the food that we consume. I like the word that some of my colleagues, Dr. Elsterson, uses, that heart disease is a foodborne illness. And many of these chronic illnesses are foodborne illnesses. It's related to the food that we consume.
Right. Now, recently, a couple of months ago, I read that former President Bill Clinton decided to take on a plant-based diet, and primarily about what you're saying, because previously, several years ago, he had heart surgery and stents, and then he started seeing things maybe coming back. Have you heard about his recent transition?
That's correct. And I write about that. I wrote about that in my book, in fact. But former President Clinton is a classic example of someone who has gone through the best of medicine, the best of our standard medicine can offer.
Absolutely.
I mean, you would think the former president of the United States would have the best.
Right.
And so when he was first diagnosed with his coronary disease, he underwent coronary bypass surgery by a very good surgeon, and had very good care. Recovered from that, but only 6 years later came back with more chest discomfort, only to have to undergo another procedure to open up 2 arteries that were clogged. Fortunately for him, that he was made aware of the data that supports the use of plant-based nutrition in helping the body heal itself. And to my understanding, he has followed this and has done quite well.
Right. Wow. That's great. Now, you mentioned that you put people on a nutritional boot camp sometimes when they come to see you. What's that all about?
Yes, we coined the term boot camp. We typically think of a boot camp as sort of an exercise period of time. There's actually a formal term that the Navy used, kind of exercise conditioning.
Right.
And in the lay environment, we sort of use it for the same reason. You know, an intense duration of time, duration of time, I should say, a finite duration of time was an intense exercise to sort of condition the body. Well, we use it in the same fashion, but instead of exercise, we use nutrition. So it's a finite period of time where individuals will come and follow an intense dietary regimen. And I say it's intense because we put them on raw fruit and vegetables only.
Okay.
Not a bite, a drop, or a crumb of anything outside of raw fruit and vegetables only.
Wow.
And
Okay.
they go through this for a period of 4 weeks, and they go through what we refer to as detoxification. So their bodies cleanse out. They have certain symptoms. Sometimes they have headache and fatigue, and we follow them closely during that period of time. What this allows them to do is to jumpstart their health. So individuals, oftentimes who are on maybe 100 units of insulin, they get off the insulin within a week or two.
Within a week or two?
Yes, we have individuals
Wow.
with coronary disease. I have a young lady that followed our program, and she had an 85% narrowing of a critical large artery that normally would require either bypass surgery or stent. And this artery, this narrowing reversed itself and opened
Really?
up. That took about 5.5 months, but her symptoms started going away within a matter of weeks.
Wow.
So we see these symptoms start to reverse in a very short period of time. Also, individuals with chronic lung scarring, called lung fibrosis. One patient was on oxygen 24 hours a day. She was able to come off the oxygen within a matter of 6 weeks.
Wow.
So when we put individuals on this nutritional regimen that's intense, to jumpstart their health, the body starts to do amazing things to reverse these chronic illnesses.
Wow, that's dramatic to see. To be able to come off medication within weeks is quite a dramatic change.
And that's correct. And my perspective, and the reason why I came up with such an aggressive approach, because there are many individuals who practice in this realm who are not as aggressive, quote unquote, in terms of just strictly raw fruit and vegetables. But however, my patients tend to be the sickest. I mean, when patients come to me,
Right,
they have end-stage heart failure. And so there's very little room for error. And so we're going to use nutrition. We have to use the absolute best form of
Right.
nutrition. And so examples would be an 86-year-old lady with end-stage heart failure on 15, 16 medications. I don't have room for error with this
It
individual.
has to be dramatic.
It has to be dramatic, and they do quite well.
Okay. Well, I know you wrote a book called The Food Prescription for Better Health, and I want to talk about that. We're going to take a break, and then we'll come back and get into what this book is all about.
Okay.
So stay tuned, and we'll be right back. We're back, and welcome back to Health 365. I'm your host, Dr. Ruby Lathon, and we are here today with Dr. Baxter Montgomery, who is Medical Director of Montgomery Heart and Wellness in Houston, Texas. And we were just about to talk about a book that he's written recently called The Food Prescription for Better Health. I've read it. It's an excellent book. I would suggest you get it. It's available on Amazon, right?
That's correct. Amazon and also on our website.
Okay.
Yes, correct.
All right, and your website is?
It's drbaxtermontgomery.com. That's Dr. Baxter, B-A-X-T-E-R, Montgomery.com.
Okay, and so they can find out all about your book and your boot
That's correct.
camp and all of that on
That's
your
correct.
website.
That's correct.
Okay, great. I was saying I read it, I love the book, and I just want to touch on a few highlights of the book. I noticed in one, it really starts out with talking about kind of the top killers going on today, the things that are really taking us out dramatically, and
That's
you
correct.
kind of address those. You want to talk a little about that?
Yes, what I try to do is take the, say, the 10,000 feet in the sky approach, get a broad, let's step back and look at the forest. Oftentimes we go through life and we just tolerate these conditions. Individuals that have diabetes, they know someone with diabetes, they have heart disease, they know someone with heart disease, and they take these medications, and in the routine of going through life, nobody steps back and says, wait a minute, there's something strange about this. And most of us are sick. And so what we try to do in the book, as many other books do, is make the case that, hey, this society is really hampered by chronic illnesses. And so we try to make the case for these chronic illnesses and what burden is taken on us as a society.
Okay. And I noticed that you talked about one of the things that was somewhat of a turning point, kind of as you were kind of changing from more traditional to more holistic medicine, that your mother was sick with some of these illnesses that we're talking about.
Yes.
And so that kind of got you to thinking about what you can do. Can you talk a little bit about that?
Yes, I share the story about my mother, and without spoiling the details from your readers, but
Right.
the point I want to make with that is my mother, of course, my late mother was very close to me, and what motivates me to do what I do are a lot of things. Clearly, my relationship with her and how she died and the whole process and the way she died and the timing that occurred really sticks with me. And the point I often try to make in talks that I give is that everybody has to put a face on this whole issue of chronic illness. And her face is certainly the face that is foremost in my mind when I put myself on the front line, if you will, toward helping individuals reverse chronic illnesses.
Right. And I really can relate to that as well, because my grandmother unfortunately passed away from diabetes-related complications. And at that time, I didn't know what I know now about natural health and how to reverse that. And so it's kind of in her honor that I go forward to try to help other people, because it's something that is reversible and that you don't have to die from.
That's correct, and we all have to think about our loved ones. It may be a parent, a grandparent, it could be a sibling, it could be a child. I mean, you mentioned diabetes. I mean, that's becoming a worldwide issue. I mean, the International Federation of Health has stated that every 7 seconds someone around the world dies from the complication of diabetes. I mean, it's a major problem, and so these chronic illnesses are having a major grip on us, not only in this society in the United States, but also worldwide.
Absolutely. In the book, you talk a little bit about a classification system.
That's correct.
That I found very, very interesting, because a lot of times when people are asking us to eat healthy, we don't really know what that means. We have a visitor on the set.
That's right.
We don't really know what that means. And so this kind of helps you out to
That's right.
figure out what exactly eating healthy is. Can you talk about your classification system?
Yeah, that's a good question. I mean, the book title, The Food Prescription for Better Health, is literally that. It's a prescription of food. And what we try to do is give people direction, very precise direction. And the question of what can I eat comes up often. When someone says, okay, eat healthy, what does that mean? And what we have done in the book is laid out a very precise method and approach to what you should eat, not only in terms of the food that you choose. So for instance, they say, okay, eat plant-based foods. Okay, that's important. That's the foundation. But once you say eat plant-based foods, how do you prepare the plant-based foods?
Right.
Okay, are you going to deep fry it or batter it? Are you going to add preservatives to it? And so we not only say, okay, these are the foods you eat, but this is how you prepare the foods. Where should you get the foods? I mean, how should it be grown and prepared? So what's the optimal level? So we created a classification system that is designed to allow people to classify foods based on their ability to allow the body to heal itself and function optimally. And so that's why, so it doesn't deal with carbs and calories and that type of thing, but it deals with food. If you eat at this level, say this level versus this level, then you're going to be better off. And as you get closer to this level, the healthier you're going to be. The sicker you are, the closer to this higher level you need to eat. You know, the healthier you are, maybe you can eat some medium level combined with this level. So we actually give this classification system, and we apply this classification system to different health classes. We give 5 different health status. Someone who's completely healthy, young, physically fit, without any diagnostic problems, they may eat at a certain level. Someone who's very ill may have to have a more aggressive level. So we have them help them sort of dial it out. So the food prescription actually walks you through that, and there's a step-by-step approach that's described.
That's great. That's great. And so, because when you talk about your boot camp and a totally raw plant-based diet, that's probably going to scare people off a little bit.
That's right.
But it's not forever necessarily.
That's correct. It's not forever, and people often say, well, can I have this, can I have that? And it's great you make the comment, is it not forever? Because oftentimes when people ask you to do something, they say, well, can I ever have this, that, or the other? I say, I'm not trying to change the law of the land. What I'm trying to do is give you a methodology, teach you how to do something. So, for instance, you go through the boot camp, you detox and cleanse. You come off, and hopefully you're eating at a healthier level than you started. So let's say maybe 6 months, 9 months, 12 months later, you may want to detox and cleanse yourself again. So you have an understanding and you have a tool, if you will, in terms of how you can clean your system out. You may be in a stressful condition where maybe you have, I don't know, exams if you're a student or work assignments or deadlines. You may want to detox your body to help it function at a higher level to get through that stressful event. So this is a way of giving you a tool or methodology to use food as medicine, use food as a tool to enhance your health.
Okay. And like something like this apple, where would that fall into the classification system?
Yeah, the apple, the classification system is level 0 through 10.
Okay.
The lower the number, the healthier it is. 0 would be raw juiced foods. Levels 1, 2, and 3 are all raw foods, but they have a different level based on, say, the glycemic index and nutrient density. The apple would be somewhere on the level of a 2. Depending on, say, if it's a Granny Smith apple, it's likely a 2. But most apples, apples are level 2.
Okay. All right. Well, that's great. And then you kind of wrap up near the end talking a little bit about results. And there's some dramatic results that you've seen, and we talked a little bit about that already.
That's correct.
But things like lowered cholesterol, weight loss.
That's
Can you
correct.
talk a little bit about your results?
That's great. We track the laboratory values, and everybody's gone through the boot camp. The boot camp's been operational for just about 3 years. We're actually coming up on its 3-year anniversary in
Wow.
the 1st of
That's
December.
great.
And we've had over 1,000 people go through the
Wow.
boot camp. And we've seen consistent results of reduction of weight, reduction of 2 inches off the waistline in 4 weeks. So in 4
Wow.
weeks, we've also seen significant cholesterol drop on average. Now this is unusual because typically it takes about, say 4 to 6 months to see a well-defined drop in cholesterol, but on average see cholesterol drop. There are other parameters that we measure, such as the amount of inflammation in the body. There's a lab value called CRP, or C-reactive protein. It measures inflammation in the heart and blood vessel system, but it also gives some insight as to inflammation in the body. And we know that inflammation underscores most, if not all, chronic illnesses. And so if the body's being reduced in inflammation, then you're reducing your chance for many of these chronic illnesses. And so blood sugar goes down and the like. And these changes are happening at the same time individuals are coming off the medication. So we see an average reduction in medications while at the same time seeing a reduction in blood pressure, reduction in blood sugar, and the like.
Wow, that's dramatic. Now, I know you probably don't track your patients forever, but you probably see them occasionally. Are most of them sticking with it? Because, with most dietary programs or diets, you have the yo-yo effect. Sure, I lost 20 pounds, and then 6 months later, I've gained half of it back.
Yeah, no, that's true. We have a certain number of individuals who we follow over a long period of time. The interesting thing is the following. We see a very significant success rate in terms of people sticking with a large portion of the nutritional regimen. The major portion is removing all forms of animal flesh and staying on minimally processed foods, so staying away from the fried, processed carbohydrates and the like. We have a success rate. Now, these numbers are not hard and fast because, as you said, we don't follow everybody closely, but we have a success rate somewhere on the order of about 70% at the end of boot camp, and it maintained those who we follow long term, somewhere around 50 to 60% people sticking with the program, and a simple majority do stay off animal products 100%. What we find is that if you compare that to, say, medication compliance, well, there's been people that estimate that medication compliance is somewhere on the order of 20%.
20%.
20%. So if you say, okay, the percentage of people that comply with this regimen compared to the percentage of people who comply with medications is significantly better. So oftentimes you say, okay, individuals, everybody doesn't stick with this, and we understand that. But if we compare it to what we're doing with traditional medicine, it's much better.
Absolutely.
And you may ask why. Well, individuals are getting better. They get a positive feedback. If you take a medication, your blood pressure may go down, but you may have a side effect to that medication.
Right.
So your blood pressure goes down, which you may not have felt to start with, but you said having a side effect to the medication, which you do feel, and so that may be an adverse aspect of taking the medication.
And one more thing I wanted to get in, because you talked about a plant-based diet. Most people are going to say, where do you get your protein? I get that question 1,001 times. So if we're talking about raw foods and protein, how is it that people are getting better eating very little protein?
Yeah, that's good. Well, that's a very common question, perhaps the most common question that we get, and I'm sure you're familiar with that. My first response to that question is, one, that's the wrong question.
Okay.
The correct question should be, where do you get your water? But to answer the question directly is that plant-based foods have adequate amount of protein, whether it's a fruit or a leafy green vegetable, etc. Spinach, kale, broccoli have more amount of protein per unit calorie than chicken, fish, or steak. So you get more than enough protein from plant-based foods. I've been practicing medicine, if I include my private practice and all the years of training, more than 20 years. I've yet to see my first patient in the United States die of protein deficiency. I see lots of patients die of heart disease, diabetes, stroke, and these are all diseases of meat and cheese. So these are considered diseases that I refer to them as meat and cheese-itis. And so there are lots of people dying of these diseases as a result of too much animal protein, but I have yet to see anybody die of protein deficiency in the United States. But the last comment is that the reason I say water is the most important nutrient is the body's made of more than 70% water. And you can go a long time without eating a piece of baked chicken or baked fish, but how long can you go without drinking a glass of water or having any form of water consumption? Not very long. And so water is our most important nutrient, yet we overlook that. If you compare watermelon to baked chicken, watermelon has more water. An apple to baked fish, apple has more water. So these plant-based foods that are raw in a natural state have more water in them, which is our number one nutrient.
Okay, great. Well, we're going to kind of test out a couple of the recipes that are in this book that talk about, some of the super foods and things like that, so we can actually get an example of what it's like to eat a healthy diet. So we're going to take a break and we'll be right back. Welcome back to Health 365. I'm your host, Dr. Ruby Lathon, and my special guest today has been Dr. Baxter Montgomery, a cardiologist from Houston, Texas, and we are going to try out one of his recipes in the book, The Food Prescription for Better Health. And it is the green kale smoothie, right?
That's correct, yes.
Okay, so
yes.
What are you starting with here?
Well, the green kale smoothie, as you said, is one of the recipes we have in the book. This is the smoothies as raw juices are level 0.
Okay.
And so what we try to do is encourage some of our wellness clients and patients to make smoothies. It serves as a good way to get nutritious food. A lot of people don't like to eat kale, or they don't know what kale is, so making a smoothie with kale in it is a good way to use a smoothie as a vector, if you will, to kind of get kale in your system without having to deal with kale. So if you could pass me a little kale out, get you started.
There you go.
And kale is a nice green leafy, and what we do is we have you take the leaves off the stalk. You can tear them up into small pieces, or you can leave them in large pieces like so. And so we take that off and pass me another stalk there.
Sure. And I notice now, I do a lot of smoothies, and with some blenders like this, the high-speed blender, you can even leave that stalk in, right?
That's correct. You can, and it's actually the stalk has a lot of water in it. And oftentimes we encourage our patients and clients to use the stalk for juicing, because you can get a lot of the juice in it. But you're right, you can leave the stalk in, it is optional. And with a high-powered blender, such as the one we have here, you can do that and it'll blend it up quite nicely. And so we'll stuff the kale there. Right. And what I'll do is I'll just pour a little bit of water here to kind of help me pack that in, like so.
There you go.
All right, just a little bit of water. Water is somewhat optional. You can use some fruits that are very hydrating. Now, another recipe calls for the kale and the berries. What I'm going to do in between the berries, I'm going to add an orange. Now, sometimes you can use fruit just like orange. You can see that's dripping with water, and the good thing about that is the hydrating effect of the fruits itself. So I'll add some orange, add some sweetness and some water, plus all the nutrients that orange have, including vitamin C. So we can add, say, the berries. Okay. Now the two options with the berries, most people like to cut the green part out. You sort of make a little circular motion here and cut into there like so. You can make a slice like so. So we'll cut a few of these.
And now you could leave the green on
You
as
can
well.
leave the green on as well, so that's an option. A lot of people like to cut the green, but you can leave the green on, because again, the green part of the strawberries have nutrients as well. So I'm just kind of demonstrating both techniques. Cutting the green off if you want for the newbies, cutting it in half, or leaving the green on.
I
So,
like to leave mine on.
all right,
I
so
usually-
we'll, in favor of the host, we'll go in favor of the greens on.
All right.
Now, we got some frozen berries here.
do.
Now, the thing about the frozen berries, the nice thing about frozen berries is that you can get fresh frozen fruit. The shelf life is a long time. Lots of times, individuals complain about, getting fresh fruit and having to buy it more frequently or having it go bad. You can get fresh frozen, but make sure you always read the ingredients and make sure the ingredients just state the fruits and no other preservatives or anything added to it.
Right, and particularly for berries, I think it's important that they are organic if possible.
That's correct,
Because
that's
they're
correct.
one of the fruits that are heavily sprayed otherwise. So you can get away with some fruits that are not, but your berries and some of your leafy greens are the ones you should.
That's correct, and they're heavily sprayed, they're thin-skinned, and so the chemicals get inside the depth of the berries, so that's exactly right. So there's a preference for organic berries whenever possible. So now, you can do a few other things too. Oftentimes, if you have something like agave nectar, if you're not accustomed to having a smoothie with a kale, and if you're very new to this, you may sweeten it a little bit. Now, typically the orange can sweeten it, also berries, but you can add a natural sweetener called agave nectar. This is a raw blue agave nectar, and you can add just a little touch to help not so much sweeten it, but to cut some of the perceived bitterness from the kale.
And now agave, we've heard a lot about different types of sugars. And where does agave fall into that spectrum? Is it one of the healthy sugars? Is it like any other sugar?
Yeah, and I get a lot of questions about agave. I mean, agave comes from the cactus plant, and the raw blue agave is minimally processed. It's extracted from a cactus. It's organically grown, and it's a natural sweetener, and I like to describe it as minimally processed. Now, there are many sweeteners that are what are called high fructose corn syrups. And they say, okay, well, agave has fructose in it as well. But this is not a processed fructose, and it doesn't come from a genetically modified plant. And so it's a different biochemical structure altogether. And fructose is one of the natural sugars found in nature. So it's just because something has fructose in it doesn't mean it's bad, but the typical high fructose corn syrup is a heavily processed food, come from a genetically modified plant in most cases.
Okay, great.
Now I'm going to actually deviate from the recipe. I'm sorry.
I see you're taking from our bowl of bounty.
Yeah, I see the bowl of bounty. But you can add bananas. Now bananas can add a little bit of body to the smoothie. So oftentimes people like when you think of smoothies, you think of adding some dairy product like yogurt or milk or the like. You don't have to do that. You can add extra bananas. Also, you can add avocados. Avocados add a creaminess and a little bit of texture to the smoothie as well.
What I've noticed too, we have some mango here, is that when you leave the skin of the mango on, it adds some creaminess.
That's exactly right. That's
well.
exactly right. And you don't have to hassle with.
Right, you don't have to peel it.
Peel it.
So, and it's got great nutrients in there.
That's right. That's exactly right. So, I mean, making a smoothie can be just a lot of fun. Notice we're not, granted we have a recipe, but we tell our clients and our wellness members that use the recipe as a foundation. Don't just follow the recipe you wrote. You take that recipe and say, okay, I want to tweak it left or tweak it right.
Right.
And so it does add something to it. So I'm just going to add a little bit of water so that we can.
And then we don't want to forget.
Oh yes, I don't want to forget the power food here. Just a little bit of water to help it out there.
So I'll let you tell us what this E3 Live is all about.
Yeah, E3 Live is a blue-green algae. It's a freshwater algae, a micro algae that's harvested from Klamath Lake in Oregon. It's a superfood. In our classification system, this is a level 0. And it's probably at the highest level because, one, we classify foods not only based on the fact that they're plant-based, but also, is it raw? This is raw. Is it liquid? This is in a liquid form. And also, how was it cultivated? How was it developed in nature? But this was harvested in its natural environment, which is better than even organic. If you look at something that's naturally harvested in its wild environment, this food is going to be hardier because foods that have to grow in their wild environment, they have to have extra nutrient concentration to fend themselves off their natural predators, if you will. And so the plant-based foods in the same way if they're in a wild environment, tend to be hardier than even if they're grown organically. So,
Okay, great.
so here's a little bit Eat Through Live. And,
No, the recipe said 1 or 2 ounces.
yeah, I kind of freelance
yeah.
here.
Okay.
And this is a food, and even though we have prescribed amounts, oftentimes they say, well, how much of this I take? I've drunk an entire bottle of this in one setting.
Really?
Yes, and so, you know,
Okay.
but again, it's a superfood. It's
Right.
not a medication, so there's not a
There's no danger in overdoing it on algae.
well, I've yet to find it. So anyway, so maybe next year when I'm here at the show, I'm growing horns, you'll know the story. So anyway, we're going to get it set to blend. And again, what you do is you start off at a low speed. Now this particular type of blender is one that has a variable speed. So this is off. So we'll put it on variable. And we'll start off kind of sort of midway. And as I turn it on, it'll start slow, and I'll gradually turn the speed up. And if it gets bogged down, some of them have plungers.
Yeah, the damper.
But that's okay. If we don't have the plunger, we can always turn it off and add more water. So let's give it a whip here. So you're starting off slow here, and as you kind of speed it up. Sometimes we create a vacuum, so we'll see if it pulls it down. If not, we'll sort of put it on pause. Put it on pause, and then what I'll do is, we don't have a spoon. Add more strawberries, okay? It'll take the color to red. But despite the fact that it's green, it's going to be a nice sweet beverage. Now, right now, it looks like it's done and that it's liquid. I tend to let it go a few minutes longer to let it really, chop those vegetables.
Put it on the high speed?
And you put it on the high speed also. And notice the berries are in there, it's not perfect. Interest of TV, we'll cut it short here.
Yeah.
And
You can always add extra ice if you like it a little colder, right?
that's correct.
Okay. So we'll try this out.
All right.
That looks
See how full body that is.
delicious.
And this can serve as a full meal. I mean,
That
you
is-
saw the ingredients.
Delicious. Very good.
Yeah.
So
Great,
you can
great
have this
taste.
any time of day? Does it
Any
have to
time
be
of
breakfast?
day. Any time
Okay.
of day, yeah. It can be
So-
breakfast, lunch, dinner. Oftentimes people come back and they may be hungry at the end of the night. You can make a smoothie. It's a nutritious beverage. It kind of fills you up. And the thing about the smoothie, you would think that, well, I'll need more. Many of our clients, after having a smoothie, it will. If they have a smoothie for breakfast, it'll last through lunchtime often. Part of it is that it doesn't have to fill you up. We're constantly, eating nutrient-dense, nutrient-poor foods. It fills up our stomach, but our brain is not getting the nutrients it
Right.
needs. This is going to fill up the body in a nutritional value. It's going to nourish the body at the cellular level.
Right. Well, this is excellent. And I know we've got a few more recipes, so we're going to take a break while I get to drink my smoothie, and we'll be right back. Hi, and we're back. And we're going to try, back again with Dr. Montgomery, we're going to try 2 more quick recipes for people who are always talking about they don't have time. These are some really easy, quick, simple recipes that are very good that we're going to demonstrate with you. And the first one is a lima bean and corn thaw. So I'll let you walk us through that.
Yes, and it's good you point out that the time-saving factor. Now these are just a couple of bags of, this is a bag of lima beans, and typically what to do, you can take this straight out of the freezer. What I'll do is I'll pour some in a bowl. You get hot water. Now sometimes if you, some individuals have the preheated water, you can bring water near a boil. And then what you do is just take the water and pour it into the lima beans like so. And what happens now, the beans are usually picked fresh, and they're frozen after being picked. And so they're fresh frozen beans. So what you're doing is thawing them out.
Okay.
The actual picking, and oftentimes they'll rinse them and freeze them, the freezing and then thawing them again kind of softens the membrane, so it makes the beans a bit tender.
Okay.
Perhaps a little more firm than you used to if you cook them for 2 hours.
Right.
But very nice and tender for the taste. And so what I'll do is I'll splash that around a little bit, and I'll take it and then just sort of strain it, like so.
So it's not necessary to really cook these because they're already just fresh, basically.
That's correct.
Okay.
That's correct.
So it's
And
almost raw, basically.
it's almost raw. And so this is what we call it the level 4. Level 4 are foods that are lightly warmed or lightly steamed. So like, times like we're getting into the winter time and people don't want to eat something cold or like a salad, like a smoothie,
Right.
you can have something like this but not have it overly processed.
Right.
So we can take the corn in a similar fashion. Now this water is still hot, but you can add some more water to it, okay? And you can
And that's organic corn. And the reason, like we talk about things that should be organic versus not, corn is one of those things. Because a lot of corn is genetically modified, so
That's
you
correct.
want to avoid that. And this is organic corn, so we know that it hasn't been.
That's exactly right. Now, normally I would have a sink or a bowl. Typically, I may ask you to just go to take. You can do one or two things. You can kind of scoop the corn out and put it in a strainer, like so. And this is a spoon that has holes in it. So, for the purpose of time and being on TV, so we'll scoop it out like so, and and then we'll add the corn to the lima beans, almost like a succotash, if you want. Okay. So now you have your thawed corn and your thawed beans. Now you can add a seasoning. Many people have their favorite seasonings. We have some fresh cayenne here, which you can add to, and basically going to season it to taste. Another recipe calls for certain things. If you have a touch of sea salt.
No, sea salt as opposed to white table salt, right?
That's correct. White table salt is a heavily processed salt. Typically, they take the sea salt and then it's boiled up to about 2,000 degrees. They extract a lot of the other minerals and leave just a pure sodium chloride. Because of the boiling, it turns into tar, so it has to be bleached, and have to add caking substances to it. So regular table salt is a heavily processed substance, unlike sea salt, which is minimally processed at all. And here's just a natural seasoning, which is a blend of rosemary, oregano, sage, and ginger. Again, the seasonings you can add to your
Kind of to
taste.
your liking, right?
To your liking,
There's
that's
several,
correct.
and that's a no salt seasoning because we already added sea salt there.
That's correct.
Okay.
And basically, you add enough to you're almost about to sneeze, just like I was almost about to sneeze.
It smells good.
Mrs. Dash is another popular brand. Again, a no salt seasoning. And so what you've done here in just in a matter of a few minutes, us doing this and talking, is you've taken food from the freezer, just a little hot water, thaw the beans, and then you serve it, season, and you're ready to eat. And so, after a busy day at work or school or whatever, you have a nice, delicious meal. Now, let's say, for instance, if you've done the thaw and it's not as warm as you like, then basically you just have it thaw again, run another amount of hot water through it. So you can do a double thaw and warm it up gradually.
Or you can have your water close to boiling, as you said.
Have the water close to boiling, that's correct.
Okay.
Yeah.
Ooh, this is very good. Simple.
Yep, simple, straightforward
Easy.
way of preparing. So what I'm going to do next is we've got the mashed potatoes.
Sure.
So let me do, I'll tell you what, if you can get rid of that, and I'm going to
Absolutely.
take the potatoes. Now the potatoes, again, it's another level of amount of work that's used. The potatoes are boiled roughly 20-25 minutes ahead of time. So these potatoes have been boiled, and so what we'll do is and I will cut the potatoes. Now oftentimes we'll take the potatoes, and you can if you want to decrease the amount of time it takes to boil the potatoes, you can actually slice them before boiling. So you can cut them into small slices and boil them. That'll decrease the amount of time it takes to boil them. But anyway, these were boiled whole.
And sweet potatoes have a number of nutrients as opposed to white potatoes, right? Because
That's correct.
we're told to stay away. What's better about the sweet potato than the white potato?
Well, it's a lot of more phytonutrients. It's lower on the glycemic index scale.
Okay.
And the color has a lot of beta carotene
Okay.
in it, and so it's much better than the white potato. If you use the white potato, we do have an ingredient for white mashed potatoes. You want to be especially careful to get the organic white potatoes, There are some stories about potatoes in general, the non-organic ones being used as in between crops. And so sometimes, you know, they'll
nutrients.
grow, they're low nutrients, but also they're used to absorb the chemicals from the crops. Let's say you have, you know, a crop that you spray a lot, and in between crops you may want to get the chemicals absorbed from the soil. You may grow potatoes between, so the potatoes are absorb the
so that's something you definitely want to avoid.
Yes, and so you want to be careful with that. So we have the potatoes here. I'll place this on the back here. And so now you have your potatoes. Now the simple thing is to just simply mash them. So you can get a spoon. We use a potato masher. It's not really necessary. And you can see it requires high amount of skill here to mash the potatoes. Now,
you could put it in a food processor, right?
You could, but to be honest, I think it's just better. The food processor will make it so uniform. By mashing it by hand, you kind of get this sense of a texture, different textures of it. I mean, the textures overall is just different. It's kind of a full body texture. Now, if you want it to be quote-unquote creamier, I keep some hot water. You can add some hot water to it.
And that was the water we used to boil the potatoes in.
That's right, that's right. And so a lot of the vitamins that are there are added too.
And that's another thing that I've read about, keeping that water from things that you boil or saute or cook in. You can use that water as like a stock for soup and things like that. You could even freeze it and use it later.
That's right.
Because it does contain a lot of the nutrients, so you don't necessarily want to just throw that out.
That's right. And those we use it to thaw the beans as well.
And it adds some more flavor.
That's exactly right.
As opposed to using vegetable broths or chicken broths or things that have a lot of preservatives in it, you basically make your own.
Now these potatoes, you can just say you're done, or you can add a touch of agave nectar if you want it. If you have a bit of a sweet tooth, you can, but you don't have to. Some of our clients like to do that. And a little bit of cinnamon. We have a little cinnamon.
We forgot.
That's okay. Well, if you don't have the cinnamon, you're all out of cinnamon, you can just do without the cinnamon.
Now, I like to add cardamom to mine, because I do that, which is also kind of a spicy, similar to cinnamon. So you can add a little different flavor to it.
That's correct. And you know, if you were doing a white potato, you can add, we put the chives here, they can go in a white potato. If you were doing a white mashed potato, you can also add the chives to the bean thaw, to the corn succotash.
That would be great.
And so there are a lot of other things that you can do to dress this up. Again, what we recommend to our patients and clients is take these recipes as kind of a standard, but then add your own twist to it. I mean, we all have different likings and different tastes, so add your own twist to it and have fun. That's the key. And once you start to get into play with this, you'll find that eating natural plant-based foods is very tasty.
Well, let's serve me up a little.
Well, sure. Yeah, we'll get you some of the nice sweet potatoes.
I love sweet potatoes.
Yeah, it's that time of the year. And you know, you can make use the same approach and make sweet potato pie. So this can be filling for a sweet potato pie. Yeah,
absolutely. It almost reminds you of that.
That's right. That's right.
So I know you brought along something with you because we talk about alternative to traditional approaches, and right here we've been doing that. This is a simple food prescription for better health, as we've talked about, and so just simple things, eating natural, eating whole foods is actually your medicine. So your food is your medicine.
That's correct.
And it has better results and no side effects than traditional medicines.
Yeah, and oftentimes when I share this with my patients, you notice I'm dressed differently from when the interview, and I've got a little cap on and outfit, and when I come out in our boot camp, you have the lecture section, and then we do the food demonstration. I come out dressed like this, and oftentimes the crowd laughs. And what I share with them is that, well, you know, this is very analogous to what I wear in the operating room.
Right.
When I go in to put a defibrillator on, I have a surgical cap on. I have, you know, something over my clothes. I'll have a mask, like I have now, and I also use some form of a cutting device. And this is a surgical scalpel. And I often show this to my patients. This is the very same scalpel I use when I implant a defibrillator. And so I tell my patients, I say, well, I can either serve you with this knife, or I can serve you with this knife. It's your choice.
Well, I'm taking that knife. I'm taking the big knife. So this has been excellent. I really thank you for coming on the show today and sharing us with all your knowledge and expertise and just simple ways to really get on that path to natural health and really taking charge of your health. Because what you do is give people the prescription, they go home and they have to apply that.
That's correct.
And so we're hoping that this show has helped you do that, that you can take these tools and start applying it to your everyday life. And so I want you to tell us your website again.
Yes, it's drbaxtermontgomery.com. That's DR without a period, drbaxtermontgomery.com, drbaxtermontgomery.com.
All right. Well, thank you so much.
Thank you
for
very much.
having us. And I hope you tune in next time to the next episode of Health 365.
Health 365, the natural way, every day. 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 Health 365, the natural way, every day.